Every time each of you has spoken, it's been amazing. The richness of the panel. Thank you so much, Dr. Sami. You brought up certain chronic illnesses that I hadn't even thought of, and I would imagine that most of us had not even thought of, with particular reference to children with, developmental issues like autism and the way we treat them in our community. Thank you for bringing that practical perspective to this presentation. Dr. Inaka Yembe talked about, the way they handle these issues, so chronic illnesses here in the West. You have just highlighted certain challenges that are associated with the realities in our rural areas, with particular reference to lack of health infrastructure. We talk about 3 doctors in the whole of Cambe, 100,000 people, 7 doctors, and 3 in the Ndu region with about 70,000 people. It really brings to the forefront some of the realities that you guys live with, and coupled with the myths and the disbeliefs and other things that would hamper even those efforts by the few doctors that are in the field. So I like to take this opportunity to thank you guys so much, the doctors. This has really been humbling, the task that you guys have and the way you have presented it. And I will open the floor now for questions. And if you're asking questions, if the questions are to a particular presenter, you can say that. If not, if it's a general question that is open to all the panelists, we would give each of them an opportunity to answer. But if you want to direct your question to a particular speaker, you can also do so. I have checked in the chat and there are no questions. So we're going to open the floor, and if you can unmute everybody, please, so that people can ask their questions. For now, yeah, Dr. Njimbe Tashe Kimka.
Yes, I wasn't able. I mean, I think I sent a note to both you and Peter, but I didn't figure that. I mean, where to send it. But I think something was missing here. I did not hear about blindness and glaucoma. So I just want to hear what the panelists have to say about. I mean, because I see a lot of blindness, and I don't see enough. And the other thing I want to say regarding that is that I mean the fact that we don't have glasses. There are a lot of kids who their grades could improve just by having glasses. So I'm just like saying that. I mean, basically, ophthalmologic care is something which I don't think we stress enough as a chronic illness, and which can lead to blindness.
Thank you, Tashe. I'm assuming this is open to everybody. So
open to anybody.
Yeah. Dr. Zami, do you want to take a stab?
Yeah. Thank you, Nangiri, Dr. Yengi, for giving me the floor again. And Tashe Kimka, thank you too for that question. Actually, we are not exhaustive. The list is really long. We could not really mention all the chronic illnesses. And actually, as you're saying, this blindness, glaucoma, they're really there. There's, people don't know that once you have a case of glaucoma, then they have to do family screening. I think, as I'm saying, the #1 cause of, mortality in our community is ignorance. Actually, we need to really create a lot of awareness of all this. Don't wait to be sick. Proportional activities. Just know that you need to take every 6 months, you need to visit the dentist. You know, oral diseases, there are so many that are parts of those chronic diseases. You need to visit the ophthalmologist and just go for checkup. Don't wait until you are sick, until you have a pain, until you have something. So thank you, Tashe Kimka, for that question. I think it's not neglected, it's very important.
Thank you. The other 2 panelists, Dr. Inaka, do you have anything to say?
Yes, thank you. I also wanted to add, blindness, glaucoma is an illness. Blindness is pretty much like the end symptom in some people. There's a difference there, and sometimes you can prevent blindness in some people. So blindness is where you've lost enough vision to where you have really maybe just light perception, but you may not really be able to distinguish. How did you get there? Maybe you had some congenital problems where you may, if you look at the young child's eyes and where it's supposed to be a natural color, it seems white, and this child is not able to see. You see that the child is not really focusing on anything. This is where you take them to the doctor. Most of the times we have children, like somebody had said, we have these children who don't fall into the normal everything, and then we think that somebody made witchcraft on them or on their mother, and this is why the child is this way. So if you notice your child is not quite focusing, sometimes he may have just a little cataract, which just prevents the light perception from going to the brain where the child cannot see. When it comes to adults, though, there are some warning symptoms that we can have, especially if you're somebody who is diabetic. Here in the United States, anyone who's diabetic, you know that you have to just go get that checkup to see if diabetes is affecting your eyes now. We may not have the resource there in the village, but how would you know? You may notice things like you cannot see in the periphery. That's actually a sign of glaucoma, where you can see like everything is in a tunnel, but you cannot see the sides. If I sit here and I'm looking forward, in the side vision, if I do my hands like this, I can still see my fingers moving. But people who have glaucoma, they come to where they have a narrow or a tunnel vision. If you notice that your peripheral vision is going away, well, just don't blow it away. This is where you go and say, let me check if there's something wrong. Another symptom that you may have, pain. Pain anywhere in the body is your body trying to tell you, hey, there's something wrong with me here. And so people who have glaucoma can have pain. There's different kinds, closed angle, open angle, you don't have to worry about that. But if you have pain in your eyes, just don't say, maybe my eyes are tired, maybe there's something wrong. I can go and get it checked. You should get it checked at that point. So loss of vision, pain, and another strange symptom, especially if you have eye pain, and it comes with a sensation of feeling like vomiting, and you have a headache with that. That could be from glaucoma also in adults. Get these things checked. Bottom line, if something changes, just know that your body that was made in a perfect state to adjust itself, if your body starts talking to you and telling you some things, just don't ignore it, especially when it comes to your vision. Hypertension can also affect the vision. So if you have these illnesses and you're aware of them and your vision starts changing before it gets too late to where it cannot be reversed, that's when you need to get it checked. So glaucoma is actually very, very common. That one can even be managed with a simple thing like eye drops that you just get. You just get those every month and use those. One of the things that I failed to say in my presentation was medication non-compliance. Just like somebody said, ignorance is another illness. Non-compliance is an illness. What does that mean? The doctor says, go home, take this one every day, one every day. I found that very strange but when I went the second time, so I was sitting here and we had a series of patients that went and got checked every day. And we used to say, hey, this person should have this medicine. Give them this medicine for 7 days. When I physically went to check on these people, one young man took me to his house and happily showed me the whole bottle of all the medicines that I had been sending to him for months and months and months. He was so thankful and I was crying. It means that all this time, he was keeping his medicines because he was happy somebody was giving him something and he wasn't taking them. Very important. Tell your people, take the medicine. If the doctor says take it, take it. Don't think the doctor is trying to witchcraft you or the medicine man gave you something, you're going to try that first. Take what the doctor prescribes to you every single day like the doctor told you. All right.
Thank you, Maya. I'm keeping an eye on the time here. I appreciate it. I'm just going to plead with the panelists that we can limit our responses so that we can get to more questions and then address a lot of the other issues. I appreciate that. But I wanted a follow-up question to that. I have two questions, but let me follow up with this, because one of the things that we've not talked about is availability of resources and conflicting priorities. I'm a scientist by training. At one time, we went to Limbe to do a training on risk assessment. and from a toxicology point of view. And we were trying to talk about long-term consequences of ingesting things that are potentially harmful to us. And as a toxicologist, you always say it's not just the dose, it's the duration. And so we try to tell people about not using containers that they've used for weed killers to carry water, because over time, you know, the chemicals can cause harm over a long time. If you ingest something once, it may not harm you, but if you take it over and over and over again, it eventually harms you. But we actually face resistance. And people basically told us that, you know, that is a risk that is somewhere in the future. They cannot see it, but today they have a need. And in order to satisfy that need, they may have to engage in some practices that would cause them harm in the future. But they might say something like, if I die for hunger today, if I not chop fish, will be poison, but if I wait, I may not develop this cancer. So I think I wanted to talk because Dr. Simon, you talked about go to the doctor every 6 months to check, you know, dentist or vision or what have you. But we know that in our community, and somebody mentioned, I think it was Dr. G or maybe Vera Tamfo, that if an illness is not visible, if somebody is not lying in the bed and not able to wake up, they don't think they're sick. So how do we train people to take a serious risks that are developing? And this would apply to, you know, maybe you're having constant headaches from that could potentially be because of hypertension that could lead to a stroke, but they have so many other needs, especially in the rural areas, that they don't see that as imminent. You know, how do you train them with acute risk and chronic risk that may not be evident today, but in the future? And that relates to, you know, dentistry, glaucoma, and even these build up to all these long-term illnesses. I just wanted to bring that back, redirect before we go to the next questions. Maya, I'm going to give you the chance to talk first. When resources are limited, how do we get people to deal with risks that are not evident today?
That is a very tough question. You're going to have to rephrase. As is Dr. Dennis is I truly got lost.
So the question is, in the villages, people have a lot of immediate needs. They don't have the resources to go to the doctor when they're not very sick. And so if you try telling somebody that if you're beginning to lose vision in your periphery, or you're beginning to have constant headaches, or something like that, go to the doctor. And they may just dismiss it like, I'm not lying on the bed sick. You know, how do we make people to understand the importance of all these signs and symptoms and to deal with them now?
Yeah, just before Dr. Enaka jumps in to respond to that, I think that the question, this question is someone who has experienced it and should be a medical doctor as well. With the permission of Mangiri, maybe Dr. Bawe will just want to say one or two things and just reframe the question. Dr. Bawe, over to you. Did I get that? Was that from Dr. Bawe? Edwin? Yes, Dr. Bawe, Edwin, over to you. Just to rephrase the question, and if, for example, it's an experiential issue, you can as well give us one or two pieces of information on that.
Okay, Chanio, I greet everybody in the house. So, yeah, regarding the question, I just really think that if you have, sorry, maybe I just throw it back. If you can just explain more, Dr. Anaka, let me just get the highlight of what the question is about.
No,
Omar Lilian, maybe you can just repeat it again. Yeah.
I thought that you were the one who asked the question. My apologies.
Oh, no, no, I'm not the one. I'm not the one.
Sorry. Mr. Tambo, I'm the one who asked the question as a follow-up to the first question, because both Dr. Mfoningwe and Dr. Inaka Yembe had talked about the importance of constant visits to healthcare.
Right.
And I asked about when resources are limited.
Sorry about
yeah.
Okay.
I think Dr. Yembe was about to say something.
Okay, so thank you for that. So when you talk about limited resources, I think that you are referring to limited healthcare access and limited ability of these people to financially take themselves to those facilities. Here, for example, in the United States, where I live, of course, it's the same thing that happens here as back home. Let's not look at people back home as if they came from a different place and they're not equivalent to those here. So we can always use the template of what's happening here successfully and try to copy that back home. That was one of the real objectives of the Yembe Foundation. I was under the misconception that people who couldn't get to the hospital, it was just their fault. It's not their fault. They don't have the resources. If you go into the deep part of Mbut and tell a woman to pay $500 or 500 francs to go to the hospital, take her child, she doesn't have 25 francs. That's where me and you need to step in. Just like the American government does, or these developed countries, they take the resources of those who have and they try to spread it equally to those who need and who don't have by themselves. So even though I send the information back home, if they cannot get there, I can only change one life at a time. I can tell myself, well, you can't see now, but I'm truly bald, okay? Instead of going to the hairdresser to get my hair done for $30, I can take that money, send it back home, and I need 5 of those women to be taken to the clinic to get themselves checked. That's how that's gonna work. And if you cannot take the whole community, that's okay. But you can make a difference in just one person at a time. Like we say in the African proverb, if you light your path at night to go somewhere, you are automatically lighting the path of so many people who's walking beside you. So we need to try to change our dialogue some. There's so much that we can do here. I can send my own resources quietly to help one person, that's okay. Or I can just pull 2 people and say, hey, how come every month you give me $10, I put my $10 down, let's help those people. They need our help. No, it's not gonna work with them, us telling them to do it by themselves all the time, because I have walked the path to those people in the deep interior who don't have the resources. Number one, is not their fault. Number two, it's no need trying to tell them all the time to get to where they can get health when they can't. We need to jump in and bring them along. That's how
Dr.
works.
Dr. Simon, your hand is up, so you can unmute and speak. Thank you. Dr. Simon is currently muted.
Yes.
All right.
Thank you. Yes, I just wanted to add just one little comment on this very important, tricky question. The reality is that it's around poverty. And as I mentioned, ignorance is there and poverty. Because you see in our health system, 70 to 80% of our healthcare financing is out of pocket. Private insurance, statutory health insurance, I think we are just trying. You see, universal health coverage that we just started, launched last year, 2023 in April, where we have only 4 areas of interventions. You have HIV, that is free, tuberculosis treatment, that is free, and then you also have treatment of malaria 0 to 5 years, children 0 to 5 years, which is still, it is free. And now we are just starting the extension to what we call health voucher. So I'm very happy that this point is coming up so that any pregnant woman at home now pays 6,000 francs, and that is what is all sponsored by the government. You pay 6,000 francs, and all your antenatal clinic and all the delivery up till 42 days. They follow up your child up to 42 days of birth. That is just coming in. I think it's still new. I just said I should point that and to say we need to create this awareness, and hoping that health insurance will come up so that people might go. All our mutual health organizations that we created, most of them started limping, and then somebody said, I've contributed for 3 years and I've not benefited. And they go and see a doctor. Can you fake me some receipts so that I go and so those are the things. You see, fraud is a problem that will kill all these mutual health organizations. Thank you.
Thank you so much. I think it's Susan Le Champion. I don't know. Is that you, Susan? You have your hand up. Thank you. A quick answer before we move on to there's some questions online.
Oh, not an answer question.
Oh, so let me go to, so this was on this, Dr. Brian had a question is to the panelists, how do we blend complementary medicine, herbal medicine with conventional medicines? And I think I'm going to try and link that to the other question, which was due to the shortage of personnel and health facilities in Du and Cambe, are illegal health facilities and drug vendors encouraged? So the first part was, how do we blend this, we call it traditional medicine or herbal medicines, with the conventional medicine? And I think that is important because going back to what Dr. Yembe said, sometimes people mistaken going to a witch doctor and going to a herbalist. And so how do you guys in the field make sure that those two are not confused? Dr. Zami?
Hello? Hello?
Yes.
Oh, okay, someone hands was up.
Hello?
Am I giving the floor?
Let me just hold on a minute, Dr. Zami. Mommy Yembe is on the line. Mommy, you had a question or you wanted to speak to this?
Yes, just a little bit I want to chip in about this
Okay.
helping the children back home, our community in the villages where we have identified one of or some main problems are ignorance and accessibility to these family healthcare units. My suggestion would be that our Mbum associations, in the out of village places like Yaoundé, Douala, the diaspora, they can play a big role in trying to help our communities in the villages with this accessibility to health care units or to health programs. We know that, like right now, we are sitting in a Mbum forum. Our development cultural associations, we can, we try sometimes to raise funds. We do in the diaspora. We can try to empower our communities in the villages where they lack even 500 francs to help themselves or their family members to go to a health center for what we have identified as even regular checkups every 6 months or every year, pap smear and all that. We can do that. Try to empower our people at home to be able to have funds. We can discuss it in our development. Like right now, we are sitting in the umbrella of Canada. We have Mbum meetings and women's meetings like Mbum all over. So my suggestion is that we can empower our people at home to be able to have the resources, the money to go even for regular checkups.
Thank you so
I
much,
just
Mami.
thought I should say that. My
Very
name is
important.
Faustina Yembe. I am not just a widow of Mbum or of Mbot, but I think I am really a regular wife, even though my husband is dead of Mbum. Thank you.
Very was it, Mami. Our Mbum can do a very well for your contribution.
Thank you.
Now, so I'm happy you brought up that topic because it was still about access and availability, and she makes some really great points about maybe some of the funds that we raise in our communities getting to be targeted towards this. So that was a great closing and segue to the next section, which was about how we blend complementary medicines with conventional medicine. And Dr. Nsame, you were about to say something.
Thank you, Doc, for giving me the floor once more. How do we blend that? You know, the Minister of Public Health, I think, has this department is really encouraged because there should be some regulation. If actually it's not regulated, then you just say that, oh, you take this, all these herbs, and then you put and you start selling. You know, it will not work. Let me just point this example. You heard about issues of acute kidney injury, acute kidney failure that we pointed out in Bamenda, and the regional delegate of public health had to we had to write, and then the regional delegate of public health raised that alarm because we had 2 cases of acute kidney failure, and then we saw that they were consuming some drugs, this Jiximol, that the Minister of Health had to stop the consumption of this Jiximol. And you know, the population said, oh, it's because we are not receiving patients in our hospitals. That's why we are stopping drugs that are helping. But these are silent killers. Your kidney will not just stop there. Maybe it's in months to come. So this herbal medicine are encouraged. The Minister of Health, I think we saw the one of Monseigneur Cleda during the time of COVID. They were officially authorized. And so the population could use. So it's just a matter of knowing how if they have something, where they should go to so that it should be tested and saying that it is okay. And the next thing, does it mean that where there are all this lack of health facilities that we are encouraging illegal? No, we are actually fighting against all these illegal, drug vendors or health facilities. And that really, it's the administration. You know, it has not been easy because with this crisis now, the past 8 years, I mean, a lot of them have come in. And now with the health facilities, we're unable to go to the street. You go to, in Bamenda, in Kwen main market, you see in the market, you see sheds. People are putting drips in the main market. And you just go there and try to say it is not good. The population itself, when you even enter a bus, moving from one town to the other, see the way they're advertising things in these buses that we don't even have, we don't have the scientific composition, we don't have the active principle. So we are still fighting against. I was putting all this to say that we should tell our population, our brothers and sisters at home, that don't buy drugs from the main market. Don't buy drugs from the market. Go to the health facility. Go, there are many, these public or conventional or private accredited health facilities. Go there and get your drugs from where we can actually certify the potency of them. Thank you.
Thank you so much. The panelists, anybody has another comment on this? How to blend conventional with traditional medicines?
Hello, can
Yeah.
I?
Yeah, please go
sorry,
ahead.
sorry, I lost connection for a while. I managed to come back. Yes, complementary medicine in the West may not be exactly equated to maybe a traditional medicine or herbal medicines in Cameroon. You know, in Cameroon, it's difficult to sometimes to make a difference to say who is a traditional or who is the herbalist, who is the traditional medicine and traditional healer, and who is the soothsayer. Sometimes they blend, and that market is flooded by what we call charlatans. But in our villages, there are people who have been known for ages to be traditional healers of a particular kind of thing. And those ones have some reputation. And for those ones, I don't find any problem having them to work. But we need to create a kind of collaboration between them and the regular health sector. That is, if we find ourselves in the village, they are probably located in a health area or in a health district. They should be known by the health authorities there and try to work in a kind of collaborative manner. So what we are trying to do at the level of ministry is we have a department, a service of traditional medicine who is trying to work with these people to get them organized in associations where members can be identified and their specialties booked or logged on, have a look where we can know that in this particular area we have these persons who do traditional medicine and these are their area of specialties. And once that is done, it's easy to do collaboration. But it is still an uphill task, and it's improving, but it's still an uphill task, and most of it has still to be done. I think there is need for that collaboration, but those people need to be organized, reorganized, and we know who is who, so as to sift out the charlatans from the real ones who are doing good work.
Thank you so much. Dr. Yembe, I don't know whether you have any comment on this question.
I mean, not really. The only caution that I'll have is just for people to know that there's a difference between medications that are tested and proven to work, because those have some form of regulation by whatever government, wherever they are produced. Some of these, so like the speaker earlier said, these traditional medicine healers, especially those who use herbs and those who have a good reputation, they know. But there's a difference between taking those herbal medications, and especially if you want to mix those with a conventional medicine now, we don't know how they're going to interact, because whatever you're taking wasn't tested and proven. I didn't say it's not going to work, but I'm just saying that we don't know how it's going to interact with the medicine that you're already taking. So there's always a caution there. If I have somebody who's taking a conventional prescription medicine, I will not advise them to mix it and take a herbal medicine at the same time, just because we don't know how those are going to interact. And the part that's going to suffer is going to be your body. And as has been said, we don't always feel how our body is suffering until maybe it gets too late.
Thank you guys so much. So for me, as a traditionally trained scientist, I always have an aversion to these medicines. I work in the pharmaceutical industry, and I know that maybe 90% of the drugs that we take, especially small molecules, have their origins in herbs, plants, leaves, roots, what have you. But as Dr. Yembe just said, we test them, we extract them, we know the doses that are safe, we know the doses that are potentially toxic, and we also get them away from anything else that can be found in that leaf that could be toxic to the patient. Here in the West, even when people go to holistic medicines and take them, it could be for maybe illnesses that there's no conventional cure based on the medications that have been developed. But one of the things that I've seen, and I know that because in my own family, people go to the hospital and they're diagnosed with something like high blood pressure or diabetes, and they have medications that work. But because they have to take them every day, some person in the village has told them that, forget that, if you just take this herb or drink this for 7 days or whatever, it will cure your diabetes, it will cure your blood pressure. And they end up not taking the medicines that are prescribed for something that should be very well treated. And they go to these herbal medicines, and then they end up maybe getting some, side effects or dying. And so I think maybe to Dr. Nje and to Dr. Sami, who are in Cameroon, even when the health minister approved some of these traditional medicines, what validation do you have? What tests do you have in place to check that these people that have approved that it works, or do you just believe, like, depend on anecdotal evidence that this person has been known to treat this? How do you validate these traditional doctors to know that this one actually works? Maybe I'm going to give that to Dr. Nji, since I understand you're at the level of health policy as well.
Okay, thank you for the question. I think this phase of accreditation and validation of medicines or patterns that are developed by herbalists or traditional healers remains very rudimentary in Cameroon. I don't think that we have been able to actually have a number of them validated or patented by the Ministry of Health. During the COVID-19 pandemic, there were so many concoctions coming up, and one of them, that of Bishop Cleda, as Sami mentioned, was like actually working. And then the minister had a delegation from the Department of Pharmacy that was put in place to work with the bishop and to actually study the medicines in view of validating it. But I'm not sure that we had a final validation of that yet. That is, to the best of my knowledge, the example that I know. The others, I have no idea. So it's still a rudimentary thing that is ongoing in Cameroon, but I think the COVID-19 kind of fast-tracked it. Thank you.
Thank you. Just maybe there's a student here, Emil, who has said that I think he's a graduate nurse student from University of Bamenda, and he is interested in educating our people in the grassroots. And so he would like to get in contact with the speakers. And the question is it okay to share your information with somebody who is interested to get in touch with you through 3 speakers?
Yes, for me, yeah, you can share my contacts. You can share my contact with the person. Maybe we might have to do some good things together.
Dr.
Yes,
Zami?
I think we are open contacts, the emails.
Okay.
Maybe we'll just write it too on the chat immediately if she can get it too.
All right, thank you.
Can share.
Maybe Mr. P, if you can just write the email addresses of the speakers in the chat so that Emil can get to before the end. We're like 30 minutes away. I think Benedict talked to you, said you have a contribution. Are you still online? Do you want to speak now?
Yes, Doc. Good evening to everyone from Cameroon time. Okay, I just want to make a small contribution. Another way we could use to blend the conventional treatment and what's happening at the grass fee is also helping us to be able to understand that there are factors that influence the demand for healthcare. So most of these grass fee persons, they actually have some factors that influence them to really actually just going for those medications, those first aids, those traditional herbalists, because there are a lot of factors that influence. Another one could be just be the nearness to those places. Others could also be because of financial income. And so if we have these factors influencing and handle it from that point, we're able to cope and mitigate the situation right at the grass field, and also to work on the supply of healthcare services. There is a lot of information in the healthcare services which stays only around the healthcare services, whereby if those information do not go to the grassroots, do not go to the common man, what will happen is that those persons will be left behind and they will keep practicing what they have known, because the real thing is what they think they know. But meanwhile, the correct thing is what has been proven. Thank you so much.
Thank you so much. There's a question online. How can we make our people trust the healthcare system, given the current nature of shortage of healthcare professionals from the statistics that were shown? How can we practically go about that to help our people? I think the first part of it was trust. How can we make our people to trust? I think Dr. Sami mentioned something about when the people are saying this is not good for you, don't take it. They think that they're doing it to protect their own ability to sell medication. So to Dr. So how can we contact that, counteract that? That's a question. I don't know whether any of the presenters wants to tackle that.
Yes, Doc, thank you very much. I think it's a very important question. And yes, I think we should know that only a small number of people actually would fall sick. So with I said in Cambe, I think the number of health centers. Let me just come the health areas and the health centers were 20, and most of them are within 1 hour of walking distance. I mean, at least more than 60% of them. So meaning that if we put all these promotional activities, all what Maya, Dr. Yembe was presenting, people know when you have this, you rush and go visit the health facility for checkups. I mean, just a small number will be sick, and even those who are there. And even if there are fewer doctors, that is certain. I mean, there's a referral system. We have a referral system in the country where, if things that they cannot handle at their level, they can refer to a higher level. We should know that all the integrated health centers that are there, 60% of their activities is promotional and preventive. And just the other small numbers, they can treat the common diseases. I know now we are shifting from infectious diseases to non-communicable. That is a challenge, meaning that we'll be needing a lot of specialists. We have more of hypertension. At first, it was malaria, pneumonia, and all that the nurses could treat. But now we are shifting a bit now through this non-communicable disease, which is really the challenge now. Because the need for the health system of Cameroon, I was in the meeting in Yaoundé, I think they presented that 65,000 personnel are needed. And I think that one to really meet up for the public health facilities. And of course, that is a challenge. These resources, human resources are there, but minute things are still there, that those maybe cases with heavier pathologies would be referred to where we can find these specialists. But we are happy. It has started. Regional Hospital and next in Cambe. I think we have a lot of specialists there. We have the gynecologists are there, the trauma surgeons are there, and that is already a good start. And not forgetting the Manka in Ndu, the Baptists. I think they are doing a lot down there in Ndu too. I think treating a lot of things, doing a lot of operations. You heard about trying to refer a woman to BBH and then could not go because of the crisis. We are happy that this Baptist Health Center in Ndu is very much empowered nowadays. Thank you.
Thank you so much. Susan, you have your hand up and you've also typed your comments or suggestions in the chat. Do you want to read it? No. Okay, so Susan has written, I'm so passionate about this topic and I am glad we have gone down to the roots. Besides ignorance, poverty is certainly a reason why many people do not seek care in a timely manner. I have some suggestions as a way forward. Bring this discussion to our meeting houses and even the chief for engage in active health sensitization in our local communities. Work together to start a Mbum mutual fund system to support our people's health where people will not be worried about going to the hospital. As we bridge global gaps, we can make this happen in ways that will not be abused. Finally, if we set up global and local health networks to bring ideas and work together, we need to empower our communities by raising more MDs, I guess medical doctors. So thank you. Those are just the comments that she put in the chat and I didn't want that to be lost. I'm looking at Karen, I don't see any questions and I don't see any hands up. So any questions from anybody else?
I don't have a question, but I just have a comment, if that's okay.
Go ahead.
All right, thanks. I think it's just following up with what Auntie Susan said right there. I think it's a very important topic that we'll discuss this day. And I like the fact that there is somebody who indicated that they're willing to connect with the other medical doctors in the forum, right? So maybe encouraging mentorship as well, right? We are looking at these shortages, especially in our line. If we can have the opportunity for mentorship, young health practitioners, I think that's also going to be very helpful. So just very little steps that can contribute a lot. down in the road. So, but again, just to appreciate all our medical practitioners here. There's a lot that we are doing, especially those who are back in Cameroon as well, right? With very little resources and the challenges of, traditional beliefs and, just a myriad of different problems that you have to face every day. So we laud you for your efforts and just trust that God will continue to strengthen you as you tackle this crisis, especially in Mbum land. That's just my comments. Thank you so much.
Thank you so much. Thank you. Edwin, there's a comment from Yembe, empower the women and girl child, and that is very close to my heart. Thank you, Mami. Dr. Brian, you had a hand up. I think if there are no other questions, all right, go ahead. Go ahead.
Yes, I just want to appreciate this initiative, and I'm so happy with the discussion and debate. I believe we are on a platform where we are going to bring a significant and long-lasting change. And I'll be glad to be under mentorship or in a forum where we can put our hands together and bring up solutions that can slowly start taking our people from ignorance into a state where they are knowledgeable, they are empowered with the knowledge to take informed decisions about their health. And I think that is us saying that we are coming together as children from this community to give back to the community we came from. And together we can make Mbumland a healthier place again. Thank you very much.
Thank you so much. If there are no other questions, we have about 20 minutes. Yeah, go ahead.
Hello, I cannot raise my hand. I'm using my phone. I raise the hand on the phone. It's Tatam John. I just wanted to share maybe an experience from Yaoundé, the Mbum community in Yaoundé, whereby the medical doctors of the Mbum community in Yaoundé from time to time use the platform of the Wikoda meetings, the Mbum meeting in Yaoundé, to carry out some health education. Although not very regularly, but it's something that has been going on, whereby we could, a medical doctor is selected to say, to give a talk, and the medical doctor decides on the most prevalent or the most, something that is close to his heart and that can be of help to the community, and then prepares a talk on that and dishes it out during a Wikoda meeting. So that has been happening in Yaoundé, and I think that could be maybe extrapolated or extended to other Mbum communities in Cameroon. That was just a comment I wanted to make.
Thank you so much. I think we have 20 minutes, and what I wanted to do is to circle back in order to round up, to just give maybe 2 minutes to the speakers, and I will start from maybe if people who had given the prelude. Oh, Enes, Shay, sorry. One last thing, quick question, comment, your hand is up. And you're muted. Can you, go ahead, speak.
Yeah, thank you, Dr. Lee. I'm sorry, my background is not very comfortable for the video.
No worries.
I've been on and off because I've been busy trying to handle certain things at the background. I've listened to other presentations, especially the one from Dr. Dennis Sami, and also Dr. Ernest G. I've been with Dr. Ernest G before I left for United States. I was trying to inquire from somebody, why do you so much don't want to go to the hospital until it is above you? The person said, when you go to the hospital, like in La Cantini or in Yaoundé, I've been in Yaoundé, I've been in Douala. When in the emergency, they send you to go and buy medicine. You are in the hospital still send you to go and buy medicine. Pas chercher les médicaments. Your person is dying, pas chercher les médicaments. They say it like that, and there's nothing you can do. So in the midst of that trauma, you are running for safety, and they are not sending you out again to go to the community and start looking for medicine. It doesn't, for them, so some people will not take it. I had a case where my brother's son was seriously involved in an accident. When he was rushed to La Cantina at 1 a.m., They send my brother and the other one to go and look for medicine. They start looking for medicine in pharmacy from 1 a.m. till 5:30 a.m. They could not see any medicine. So those are things that sometimes you see people, they rather prefer that Baba that will go and give them something to drink and maybe have some relief or some challenges that prevent people from accessing, or they don't feel comfortable. They don't feel comfortable. They don't like, why should I go to the hospital? Why the hospital? They send me out to go and buy and look for medicine.
Thank you, Ernest. That is a very important point you've raised, and I know Dr. Yembe has come online, and I would like them to talk to that point. Thank you, Dr. Yembe.
Yes, thank you. I just wanted to address that very briefly. At the time that I was going to Cameroon, I did spend some time touring a hospital in Yaoundé and a big hospital in Douala as well, just to see how they function. Now, what I'm going to tell you is not anything that the Cameroon population, general population, has control over. And the concept about going to the hospital and you cannot get medicine in the hospital like you get here, and the doctor gives you a list of things to go and get. That's very important. This is when you tell your people, send us that information so we can help you get those things quickly. Why is that? Because the truth is, in these hospitals, they don't have resources. The medical doctor that I went and did a tour with, one of them in the big hospital in Douala, when she told me she has a certain amount of her salary that she uses to buy medicines to take care of people, because the medicines from the hospital are not there, and neither are they from the government. Well, she has 4 children. And so whenever she runs out of a certain amount of money that she has allocated to her medicine bag to help people who come in, the most serious ones, when that's gone, that's gone. She doesn't have any more to sacrifice. So the problem to address that is bigger than you and I. The only thing that we can do is to empower our people with the knowledge that the doctor that's giving you this list, most of them don't have any choice. They don't have the medicines in the hospital either. And then when they say go out and get it quickly, that's truly what that means. Go out and get it quickly. And if you don't have the resources to get it from yourself right now, this is where you pull all the guns that you have. Text your sister everywhere, Nigeria, wherever, so they can get you that medicine, get you money so you can get that medicine now. Unfortunately, this is the reality in some of those bigger hospitals where we think that they are furnished with medicines and we think that they're furnished with resources. That's not true. All they truly have is the doctor and the nurse that's running around in circles.
Thank you, Maya. Thank you so much. Dr. Samia, if you're the director of the hospital, so I'm going to throw this at you. Is that the same experience in Bamenda? Do you send people like 2 a.m. to go buy medicine?
I mean, indeed, you know, us with the special status is a different scenario. We're from Douala and Yaoundé. And I want to thank Mr. Eneshe for sharing actually this worry. It's really pertinent. You know, some of us in this other Northwest, Southwest region, we are really blessed because, you know, the healthcare industry and education was our force, was our own leading industry. You know, people were leaving from other countries, all the other regions, and rushing for healthcare and education. I would say with this crisis now, it has not been easy. In Bamenda, during Ghost Town days on Mondays, none of the pharmacies in town are open. And now the regional hospital Bamenda, I have a list of drugs limited by the regulation from the Ministry of Public Health. I'm not supposed to put all the drugs. That is the first reason. And then now, if I put those people who have the commercial pharmacies, they say they will not sell because they need that. I have this limited list of drugs given by the Ministry of Public Health. This is one, it will treat all this number of diseases. But you can have some few that you might need to go to the pharmacy in town. And so what do you do in town? On Ghost Town days, we are going to go now probably for 2 weeks without movement. Mondays to Friday, no movement. If you don't go to the health facility, you have no drugs. That is a number one challenge. And now the issues of unpaid bills. They talked about the resources. Last year, 2023, Regional Hospital Bamenda had 46 million of unpaid bills, people who were treated. So they could not pay the, and what is happening? The ministry does not give the health facility drugs. You have been given the initial capital to run, you run and wait. We have to purchase drugs again. And so if you keep treating people, these social debts, you are treating people poor and vulnerable, they cannot pay. And in the end, for the 6 million, just the first 6 months of this year, we already had 24 million of unpaid bills. I sent them to the ministry and we are waiting. And so it's good to share some of these challenges, but to say we are trying all the 4 pharmacies in the hospital to make sure that they have to keep at least drugs that could manage a lot of things. So his concern is really pertinent. In the other world, I think you don't need to go out except you're outpatient and things like that. So it's a pertinent concern, and I think the Ministry of Health is really on that. These are some of the access to medication is also a challenge. Thank you.
Thank you guys so much for being on the front line.
I would like to add something.
Yes, please.
Yes, the concern of Ernest, Shea Ernest Budze is pertinent, but I think if you listen well during the presentation of Dr. Nsame Foningwe, he indicated that health financing in Cameroon is more than 70% out of pocket. And that says it all. Out of pocket means when you get to the hospital, you are expected to pay for your bills instantly. There is no third party. It's not like they give you treatment and then you come for payment after. That is the situation in Cameroon and in most African countries who are developing. They're not like in developed countries of the West where there is insurance and medical plans that can take care of the population, and then the third party regulates. So, in fact, the education we should also give our people, despite our very poor status, is to have some minimal savings. Minimal savings. When we say we are poor, yeah, we are poor, but at least we try to eat at least once a day. We should also try, in addition to food, to have some minimal savings to take care of our health when we fall sick. Even if we cannot cover for the whole bills at the moment, it can take care of at least the emergencies before we start looking for bills to settle the rest. That is what people should know, because when you rush to the hospital in Cameroon in an emergency, where the pharmacies are not stocked and where you don't have any provisions to take care of emergencies before you start paying for the bills, you are bound to be asked to go look for medicines, and that is the system that prevails in Cameroon in most of the hospitals. So, the universal health coverage probably is coming and may come to help out, but it is still beginning, and as Dr. Nsame said, it is taking care only of 4 areas of intervention at the moment. So people need to know that they need to make some minimal savings for health purposes.
Thank you so much. Yeah, Dr. Nji, in the interest of time, because I really wanted to give all of you the time just to go back and give some closing remarks before I hand over to Mr. Tamfo. Thank you so much. I would like to start with Dr. Yembe. Any final thoughts? Maybe just limit to 1.5 minutes, because we are 9 minutes away from scheduled closing time. Thank you.
Yes, thank you, Dr. Yengi. I just wanted to reiterate the fact that sudden death is really not so sudden. Most of the time we have some symptoms and some things that can be warning us that something is about to happen. Please don't ignore those symptoms that we talked about. I know this call is being recorded, so you can always go back and refer to them. A couple of things that I didn't mention earlier, I totally forgot. Number 1 is smoking. Smoking is a huge, huge risk factor. Here in the medical world, they tell you if you don't have the answer to a question, the answer is going to be smoking. That's the one thing that puts you at risk of having heart attacks, strokes, and things like that. Number 2 that I failed to mention, and please don't kill the messenger, I'm only a messenger here of good health, is alcohol. Alcohol. The older you get, the more your body cannot tolerate alcohol. So just because when you're in your 20s, you could drink the whole case of Guinness and nothing happened. Now that you are 40 or 50, trust me, with time, your liver, which is a single organ, that's why we do liver transplant. Any organ that you hear transplant, it means that that organ cannot totally get well by itself. So if you completely damage your liver with alcohol over the years, at a certain point, you can no longer tolerate that. So those are the two that I forgot to mention. Just be aware. Smoking, no bueno, throw that away. Alcohol, that's another no-no. If you were drinking the whole case of Guinness, please just try to limit it to maybe 1 or half per day. Too much alcohol damages your liver, your heart, your brain, your thinking, pretty much everything. So thank you for this very, very valuable session today. Thank you.
Thank you so much. Thank you. Dr. Nji, since you were talking, I'll give you another 1 minute to finish, and then Dr. Samuel will round off this final
Okay,
thoughts.
thank you.
Yeah.
Thank you very much. I want to say kudos again to the organizers of this very important session and for inviting us to be panelists. Yeah, I just want to say that there are a lot of misconceptions again regarding chronic illness in Mbumland, and we have a duty as people who have gone to school and who have some knowledge to develop real health messages to target our population in order to correct some of these misconceptions. It might start in a small way, but that small way might help out a whole lot of people. Thank you.
Thank you so much, Dr. Sami.
Thank you very much. I think I'm so happy being part of this discussion today. And I will say, take-home message, I would really like that. Let's continue to raise awareness. It's only that we are going to kill this killer disease, which is ignorance. So let's continue to raise this awareness. All healthcare professionals, where you are, in the various meeting groups, in the food houses, in the Wikuda meetings, please just say a word, just a small thing about anything that concerns health, and that will be great. And Mr. Mene, si ring the universal health coverage, civil, you rudimentary. Si wewe, you invited, you are a health voucher in your village, in your health center, anywhere you need, we could spend 6,000 to follow you up right up to 42 days after delivery. Make a big booster from the government, says you get and grab this, and I can laugh on the universal health coverage is to take care of things like chronic diseases. And then we took more than 200 cases on chronic kidney failure that are on dialysis. So, CB is about that stage to continue and communicate frankly to our population and make sure this is lefomba for health care. This is safe for health care. Very well said.
Very well said. Very well. At this point, I'd like to hand over the mic to Mr. P. But before I do so, I just want to thank you again, Mr. P, for welcoming me to this platform to be the moderator. And I know that I've had some contentious topics in the past, but this has been great because all three speakers are on the same side. We have one common interest, which is the health of the Mbum people. So my job has been made easy. I've not had to cool down any fires. And they've also been such eloquent speakers with so much information. And so this has been really great. I'd like to thank you all again for gracing this platform and giving you all your wealth of knowledge and experience, which is all going towards helping our people. Mr. P, if you can give your presentations to Mr. P, because some people have expressed an interest in having those PowerPoints. And Maya, if you have any flyers and pamphlets, I know you spoke today from your notes, if you can share any information with Mr. P so that he can send to everybody who is interested, we'll really appreciate that. Again, thank you so much. This has been my pleasure to host this event. Mr. Tamfo.
Thank you so much, Mangiri, whom I have confidence in whenever it comes to handling anything. I don't care about the nature, whatever. She's always on top of things. I want to thank again all our very wonderful panelists and all the speakers, all the participants, and to say that before we put a stop to this specific conference meeting, I would like to know if our speakers would give me the chance to further discuss with them, because there is a couple of participants. There is a young medical doctor who is doing great community work in Mbum, like something like volunteerism. And I would like to know if we can keep the forum of speakers for about 1-2 weeks again and get a follow-up team so that we know the way forward. That is always the objective of a meeting or a conference. What next? What's the way forward? So with the permission of the speakers, definitely we'll keep the forum for a while, and we will communicate some of the persons who would like to join hands on blade, put hands in gloves to carry out volunteerism work in our community, especially in the Mbum land. So once again, I want to thank everyone. Looking forward to having you again in our next series of conferences, and may God bless you and protect you. Have a wonderful weekend. Thank you.
Sabero, very.
You, Saberi.
Very, very soon.
Very still.
Very Sabero.
Thank you.